Hello, I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist practicing in Kolkata. I am also the clinical director of Genome Dove Fertility Center. Today, we are going to discuss about managing acute and recurrent UTI in a 36-year-old female patient with fosfomycin, that is a case report. Regarding our patient profile, the patient is a 36-year-old female, no family history of UTI or diabetes. She presented with severe burning while urinating for the past 2 days, with frequent urination in small amounts. She had mild suprapubic discomfort. This was her fourth episode in last 6 months. She never had fever or flank pain. She feels incomplete relief of prior episodes after being treated with norfloxacin twice and nitrofurantoin once. Her menstrual cycles are regular. There was no vaginal discharge. Perineal hygiene was accurate. Regarding investigations, urine routine showed WBC count more than 10 to the power 5 per high power field, and nitrites were positive. Regarding the microbiological test, it showed E. coli growth. Colony count was more than 10 to the power 5 colony forming unit per ml. The organism was resistant to norfloxacin and sulfamethoxazole trimethoprim, but was sensitive to fosfomycin and amicus. So the diagnosis was recurrent uncomplicated UTI due to drug-resistant E. coli. So patient received fosfomycin trometerol 3 grams single dose orally. She was counseled on preventive measures like proper hydration, voiding after intercourse, avoiding over-the-counter antibiotics, and perineal hygiene tips. She had complete relief by 3 days. There was no recurrence at 4 weeks follow-up, and she was provided with the option of postcoital or prophylactic low-dose regimens. In fact, around 1 in 3 women experience an uncomplicated UTI before the age of 24. 50% of the women can have at least one episode of symptomatic UTI in their lifetime. About 26% of women can have a recurrence within 6 months after initial treatment of UTI. E. coli is responsible for nearly 75% of the recurrent UTI cases. In patients with clear UTI symptoms, finding just 100 colony forming units, that is CFU of E. coli in urine, is often enough to diagnose the infection. Therefore, in case of symptomatic UTI, you don't have to have 10 to the power 5 CFU per ml. Fosfomycin, regarding the efficacy and safety, there was a study on 361 patients which showed that it was very much effective in acute UTI, means acute uncomplicated cystitis. In that case, the success rate was, means the cure rate was 94.7%. In recurrent lower UTI, it was 77.2%, and complicated lower UTI in 62.7% cases, patient can get complete cure. Regarding the microbiological efficacy, in acute uncomplicated cystitis, the efficacy was 97.7%, whereas in recurrent lower UTI and complicated lower UTI, the efficacies were respectively 94.4 and 83.9%. Therefore, if we consider the overall efficacy, means clinical as well as microbiological, in acute uncomplicated case, recurrent lower UTI and complicated lower UTI, it was 95.3%, 77.8%, and 64.5% respectively. So, in a nutshell, fosfomycin offered a quick, effective relief in a recurrent UTI case without comorbidities. Because the resistance to quinolones and nitrofurantoin rises, fosfomycin becomes a critical option in the gynecology output setting. Therefore, we can say that we are seeing increasing resistance to oral older antibiotics in UTI cases. Fosfomycin, the advantage is that it's a single dose, well-tolerated option that achieves good clinical cure even in recurrent cases. It's a good choice for women seeking fast relief without disrupting their routine. Thank you very much.